Have you ever finished an intimate moment and immediately felt that uncomfortable, stinging burn afterward? You're not alone. For many women, what should feel pleasurable turns into a frustrating, sometimes painful experience. And it can leave you wondering, is something wrong with me? Burning after sex is surprisingly common, yet it's rarely talked about openly. It can happen to women of all ages, whether you're in your 20s, navigating hormonal changes in your 30s, or approaching menopause. And here's the kicker. It doesn't always mean there's a serious medical problem. Sometimes, it's your body's way of sending a very clear message. It needs a little more care, attention, or balance. Imagine this. You're in the middle of a passionate moment. Everything feels right, but afterward, that familiar sting creeps in. It's distracting, embarrassing, and can even make you hesitant the next time intimacy arises. Many women silently struggle with this, searching online for answers they feel too shy to ask a doctor. And often, the solutions they find are confusing or only partially helpful. In this video, we're going to unpack the mystery behind post-sex burning, what your body is actually trying to tell you, the most common causes, and how you can prevent it naturally. You'll learn why things like stress, hormones, infections, and even everyday products could be contributing to the problem, and what simple steps can make intimacy feel enjoyable again. By the end of this video, you'll feel empowered, informed, and ready to take control of your intimate health without embarrassment or fear. So if you've ever whispered to yourself, "Why does this keep happening to me?" Stick around, because what you're about to discover could completely change how you experience intimacy. So why does it burn after sex? Let's break it down in a way that's easy to understand. Because your body isn't being dramatic, it's actually trying to communicate. One of the most common culprits is lack of natural lubrication. Think of your vagina like a delicate, soft tissue that thrives on moisture. When it's dry, friction increases during intercourse, and tiny micro tears can form. These little tears are like paper cuts. They sting, sometimes for hours after. Hormones play a huge role here. Estrogen levels fluctuate throughout your cycle, drop during breastfeeding, or decline as menopause approaches. Even stress and anxiety can quietly reduce lubrication without you realizing it. Next, there's the vaginal microbiome, the ecosystem of bacteria and yeast that keeps everything balanced. When this balance is off, irritation and inflammation can occur. For example, yeast infections, bacterial vaginosis, or even sexually transmitted infections can make the area hypersensitive. This is why burning is often accompanied by itching, unusual discharge, or a strange odor. Studies show that women with recurrent vaginal infections are significantly more likely to experience post-sex burning. Your body is basically waving a red flag. Another factor is product sensitivity. Your skin down there is super delicate. Scented soaps, flavored lubes, latex condoms, or even detergents on underwear can trigger irritation. Imagine wearing a wool sweater directly on your bare skin. It's uncomfortable and itchy. That's what some products can do internally. Lastly, don't underestimate mechanical factors and tension. Rough or fast intercourse, insufficient foreplay, or even tight pelvic muscles can create microtrauma and friction, leading to a burning sensation. Stress and tension also cause the pelvic floor muscles to contract, making everything feel tighter and more sensitive. The takeaway? Burning after sex isn't random. It's your body signaling that something needs attention, whether it's hydration, microbiome balance, gentle products, or simply relaxation. Understanding the why is the first step to making intimacy pain-free again. Now that we understand why burning happens, let's talk solutions. Practical, natural strategies that actually work. Think of this as a roadmap to making intimacy enjoyable again, without stress, discomfort, or fear. 1. Hydrate your body, inside and out. Your vaginal tissues need hydration just like your skin. Drinking plenty of water every day helps maintain natural lubrication. Aim for at least 8 glasses a day, and pair this with foods rich in water content, like cucumbers, watermelon, and oranges. These aren't just hydrating, they support your hormonal and tissue health too. 2. Natural lubrication is your friend. Using a high-quality, water-based lubricant during intimacy can make a world of difference. Apply liberally before any penetration. For women who experience dryness due to hormonal changes, consider trying natural oils like coconut or vitamin E oil, but only if you're not using latex condoms, as oils can break them down. Here's a simple trick. Keep a small tube of lubricant nearby and use it even during foreplay. Sometimes a few extra drops can prevent micro tears entirely. 3. Balance your vaginal microbiome. A healthy vaginal ecosystem is your secret weapon. Here's how to support it. Probiotics. Yogurt with live cultures or probiotic supplements can help maintain good bacteria. Avoid harsh soaps. Stick to fragrance-free, gentle cleansers, never douches, which can disrupt balance. Breathable fabrics. Cotton underwear allows airflow and reduces moisture buildup that encourages yeast infections. 4. Slow down and focus on foreplay. Rushing into intercourse increases friction and micro tears. Taking extra time with foreplay helps your body produce natural lubrication and relaxes the pelvic muscles. Think of it like warming up before a workout. Your body performs best when it's prepared. Optional enhancement. Deep breathing exercises for 2 to 3 minutes before sex. Slow inhales and exhales relax pelvic muscles and improve blood flow, which naturally enhances sensation and comfort. 5. Watch product sensitivities. Many women don't realize that scented soaps, flavored lubricants, or even laundry detergents can trigger irritation. Go fragrance-free in all products that come near your intimate area. Switch to latex-free condoms if you're sensitive, or try hypoallergenic silicone-based options. 6. Manage stress and pelvic muscle tension. Stress is a silent culprit. High cortisol levels tighten muscles and reduce natural lubrication. Try incorporating gentle yoga or stretching before intimacy. Pelvic floor exercises like Kegels to strengthen muscles while keeping them relaxed. Mindfulness or meditation to stay present and reduce anxiety. 7. Know when to seek medical help. Sometimes burning persists despite these strategies. Red flags include persistent itching, discharge, or odor, pain that lasts more than a day, recurrent infection. Visiting a gynecologist ensures proper testing and treatment, whether it's for infections, hormonal imbalances, or other underlying conditions. Think of it as getting a tune-up for your most delicate machinery. It keeps everything running smoothly. 8. Quick daily habits to prevent burning. Hydrate and eat water-rich foods. Use gentle, unscented products. Apply lubricant during intimacy. Prioritize foreplay. Relax your body with breathing or yoga. By integrating these steps, you can drastically reduce or eliminate post-sex burning, restore comfort, and even enhance pleasure. Intimacy should feel enjoyable, not painful, and these small changes create a huge impact. When it comes to post-sex burning, some small habits can make a huge difference, or make things worse. Let's go through the most common mistakes so you don't accidentally sabotage your comfort. 1. Skipping lubrication. Many women think they should just go with it, but skipping lubricant is one of the fastest ways to get micro tears and burning. Even if you feel naturally wet, extra lubrication acts as a protective layer. Don't be that person who assumes dryness won't happen. Prevent it before it starts. 2. Using harsh or scented products. Scented soaps, intimate wipes, or even fragranced laundry detergent can irritate delicate tissues. Burning, itching, and inflammation often result. Stick to fragrance-free, gentle products and let your body breathe. Your vagina isn't a soap dispenser. It's a sensitive, living tissue. 3. Rushing intimacy. Skipping foreplay or going too fast increases friction and tension in your pelvic muscles. It's like running a marathon without stretching. You're asking for soreness and micro-injuries. Slow down, take time, and enjoy the build-up. 4. Ignoring recurrent infections. Repeated yeast infections, bacterial imbalances, or STIs can cause chronic post-sex burning. Ignoring them can lead to long-term discomfort. If symptoms keep coming back, don't self-diagnose. See a healthcare professional. Quick testing and treatment prevent pain and protect your health. 5. Overusing douches or cleansers. Many women think douching cleans the vagina, but it actually strips away healthy bacteria and worsens burning. Gentle washing is enough. Anything beyond that can disrupt your microbiome. Less is more here. 6. Neglecting stress and muscle tension. Mental stress tightens pelvic muscles, reduces natural lubrication, and amplifies discomfort. Ignoring emotional well-being or skipping relaxation exercises is a big mistake. Breathing, yoga, and mindfulness aren't optional. They're part of your intimate health toolkit. 7. Waiting too long for help. Some women tolerate burning for weeks or months, thinking it will go away on its own. The truth? Chronic irritation often worsens over time and can even reduce sexual pleasure. Early intervention, hydration, lubrication, lifestyle adjustments, or a doctor visit prevents problems from escalating. By avoiding these mistakes, you can drastically reduce burning, feel confident during intimacy, and protect your long-term vaginal health. Remember, prevention is always easier than cure, and small adjustments make a huge difference. Let's wrap this up and make it actionable. Burning after sex is not your fault. It's your body trying to communicate. From dryness and friction to infections, product sensitivities, and stress, there are many reasons this happens. The good news? Most of them are preventable with small, simple steps. Here's the quick recap. Hydrate and nourish your body. Water-rich foods and adequate daily water intake support natural lubrication. Use natural lubrication. Water-based lubes or safe oils protect delicate tissues and prevent micro-tears. Support your vaginal microbiome. Probiotics, gentle cleansers, and breathable fabrics keep your ecosystem balanced. Take your time. Foreplay, relaxation, and deep breathing reduce tension and make intimacy pleasurable. Avoid triggers. Skip scented soaps, harsh products, or latex if sensitive. Seek professional help when needed. Recurring discomfort, discharge, or pain deserves a doctor's attention. Here's a challenge for you. For the next week, try adding one small change before intimacy. Maybe a bit of lubricant, a few deep breaths, or extra foreplay. Notice if there's a difference in comfort and sensation. Sometimes just one small adjustment can make a huge improvement. I'd love to hear from you. Comment below. Which step do you think will help you the most? Sharing your experience not only helps you reflect, but could help someone else going through the same thing. If this video gave you insight, don't forget to like, share, and subscribe. Hit the bell so you don't miss more practical tips for sexual health, wellness, and intimacy. Save this video to your playlist so you can revisit it whenever you need a reminder or solution. Remember, burning after sex is common, fixable, and doesn't have to hold you back. With awareness, simple habits, and a little care, intimacy can become comfortable, confident, and enjoyable again.